Well, good afternoon, everybody. It is 11 o'clock. We will be respectful of everyone's time and go ahead and get started with this presentation. My name is Tanner Funk. I'm an education specialist with the KU Health System. I'm also a clinical assistant professor with the University of Kansas School of Nursing, and I am very happy to be with you all here today. It is Mental Health Awareness Month, and we have a long series of presentations we will be delivering throughout the month of May. And the first thing I would like for you guys to do at some point throughout this presentation, if you're looking at the screen right now, go ahead and click on the chat conversation icon box and go ahead and type in your full name and also your email address as well. That way we can get you on the roster for CEUs. And that will be our official roster for today's presentation. What will happen sometime in the next 8 to 9 days, you all will receive an email from our education department that will contain a survey for today's presentation. All you need to do is complete that survey, and that's how you will receive your CEUs for today's presentation. So let's go ahead and begin. So it's so important to know that the topics that we have chosen for Mental Health Awareness Month are all pretty much related to the critical component of therapy. That's one of the main themes for Mental Health Awareness Month at the KU Health System for 2024. So we thought we would kick off this series of presentations with kind of a 30,000-foot overview on what therapy actually is and just reviewing some of the basics of it. So let's go ahead and begin the critical role of therapy. So I have now been a nurse. It'll be 20 years this May. I graduated from the KU School of Nursing back in May of 2004. And I will always say that my experience as a nursing student was one of the most transformative experiences of my entire life. I would not trade the experience for the world. And when I was in nursing school, that's when Grey's Anatomy pretty much came out. And, most of the people in my cohort, we all wanted to be ER nurses, ICU nurses, and surgical nurses. And so kind of long story short, being a mental health nurse was not something that was really on my radar until I had my first mental health rotation. And that was in the summer of 2003. Seems like a very, very long time ago. And that was my first real introduction to mental health. And a part of our mental health rotation, we actually had to go to 3 different therapy groups just to see what therapy was like, just to see what a true therapy group was like, how it was conducted, what the therapist did, just the dynamics of a true group therapy session. And those 3 group therapy sessions really opened my eyes to just how big of a deal therapy was. As an example, one of the 3 therapy group sessions I went to was for those who had alcoholism. It was a true Alcoholics Anonymous type group therapy session. And it was an eye-opener for me. I was really blown away not only by how great the therapist was and how they spoke with and related to the patients in the room. I was also really blown away by just how candid the patients were, their reflections and their observations. And I was very, very thankful to have that experience in nursing school. And it really opened my eyes to the true power of therapy. When I first started working as a brand new grad nurse, this was back in May of 2004, I worked on a very specialized unit. It was a true kind of mental health, medical surgical type combo unit. It was med surg, but most of our patients had eating disorders, alcoholism, or drug use. So it was kind of a 50-50 combo of med surg nursing and also mental health nursing. One of my biggest learning curves as a brand new grad nurse on that unit was really learning more about the role of therapy, what therapists do, how they conducted their one-on-one sessions, and also how the group therapy dynamics were conducted. And when I when I was a part of those group therapy sessions and when I was a part of those one-on-one therapy sessions with the patients and the therapists, the reality of the therapy process really struck home with me. Um, some of the things that really stood out to me were, wow, these therapists are some pretty amazing people. They have amazing intelligence, they have amazing common sense and critical thinking skills and also communication methods. Their ability to relate to patients and to find common ground with patients and to find ways to provide motivation and inspiration and to find ways to offering hope to patients really, really stood out to me. And I was just so incredibly impressed with the therapists on our unit. They were truly amazing people, and they made an amazing difference in the lives in the lives and also in the outcomes of our patients. Another thing that really stood out to me while working on that unit, I worked there for about 7 years. And another thing that became very clear to me was the very, very severe stigma of therapy. One of the things I would always hear patients talk about, I mean, we had patients there as young as 12, 13 years old as 50 or 60 years old. The one thing I would always hear patients talk about, they would always say, boy, I don't want anybody to know that I'm seeing a therapist. I don't want anybody to know that I am in inpatient therapy treatment. I don't want my school to know. I don't want my job to know. I don't want my husband or my wife or my kids or my grandkids to know. I don't want anybody outside of this circle to know. And they would say, and again, this is back in 2003, 2004, they would say they were so worried about potential ramifications. They thought that if people found out they were seeing a mental health therapist or if they were in inpatient mental health treatment, they thought that somehow, some way, something bad would happen to them. They would be discriminated against. They would be looked down upon because they were involved in mental health therapy. That really stood out to me because, again, all of our patients had major concerns about other people finding out about their therapy process. Another thing I realized was therapy is absolutely needed in the acute care world as well. Um, going into 2024, 2025, if I could wave my magic wand and make just one thing happen, I would absolutely love to see a way for mental health therapy to be conducted on acute care, med surge, ICU type units. One of the things I'm seeing a lot and telling the nursing students, we are seeing more and more and more acute care in the mental health world, and we are seeing more and more and more mental health in the acute care world. So and also more acute care in the mental health world. We're seeing them cross over more and more. And I've seen and heard many observations about, is there a way, even through giving every med surge patient, a computer or a laptop or on their phones to be part of a Zoom mental health therapy session in the acute care setting. I think that's one thing that is needed, and I think at some point we will see this come to light, seeing mental health therapy being provided in acute care settings. What it affects you. I will always say that whenever we talk about mental health, sometimes certain things don't become real or really real until they affect you personally. And back in 1997, my uncle died by suicide. And about a year after he died by suicide, my grandmother, um, who had no formal training at all as a therapist or as a counselor, she wanted something positive, something to come from his death where she could make a positive influence in the world. She wanted something to come from that where she could do something positive. So one thing she did this for the better part of almost 11 years. She had her own counseling group out of her own living room for other mothers who actually had children who died by suicide. And she had that counseling group out of her own living room for close to 11 years. And she said it was, my grandma just passed away last year. She was 95 years old. She said it was the single most important thing she ever did in her whole life. And she said just being able to help those other women and provide grief counseling and so forth was one of the most impactful and most important things she ever did. And just me being able to see the impact that she had on the lives of so many other women, it really showed to me again just how powerful therapy and counseling can be. So, big picture here, what is a therapist and why they are so important? Just kind of reading, there are many definitions of a therapist. I'm going to go ahead and read this one. Therapists are licensed mental health professionals who have unique and specialized training on assisting those who have a wide variety of mental health complications, including emotional problems, anxiety, depression, trauma, and also anxiety, with the goal of developing better cognitive and coping skills and mechanisms. So that's just one definition. I'm sure you can find many other definitions, in other areas. One of my favorite patients, who I worked with many times, she was able to come back as a recovery speaker, and she had a great recovery testimony. And the one thing I loved how she described her therapist. I loved how she described many of the therapists that she worked with throughout her patient care time. She called them the game changers. It's a pretty big term there to describe therapists, but she said the therapists that she worked with, they were game changers. And she said she, at one point, in her illness, with her severe eating disorder, she thought that recovery would be impossible. She thought a life of not having an eating disorder or self-harm behaviors would be impossible. And then she met her therapy team. And then she was able to have some true kind of groundbreaking therapy sessions with her therapist. And this went on for a long period of time. And she said her therapist was a game changer for her and literally helped not only change her life, but also helped save her life as well. That's how powerful therapists can be. The many different philosophies of therapy. I think this is important to know. In the mental health world, it is subjective. Therapists, psychiatrists, psychologists, sometimes they can be very, very different. They have different viewpoints and different practices and different med school philosophies and different therapy philosophies and different viewpoints. And, back where I used to work at, we had 3 therapists on staff. All 3 of those therapists were very, very different. They had different therapy models and they had different levels of intensity with their therapy practices and so forth. As an example, there was one therapist who had a therapy model that was based upon the concept of forgiveness. That was kind of the chief mission statement of her therapy practice, was the concept or the role of forgiveness. Being able to forgive past perpetrators, being able to forgive yourself, being able to forgive people from your life who may have been abusers and things of that nature. Needless to say, when her patients first heard this concept or this process, a lot of her patients weren't very open to that for a wide variety of different reasons. But again, a lot of her patients who worked with her and went through on kind of this forgiveness therapy model, they said it was again, it was a game changer for them, and it really helped them process and go through some very, very difficult times, and it was very beneficial for many of our patients. So the reason why I give that as an example, again, it's just so important to know there's not a standard cookie cutter therapy model for every person, for every therapist. Many therapists will conduct their roles and have many therapists will conduct their roles very differently and have many different therapy models they will use and utilize. The many things a therapist can do. So what does a therapist do? What is their role? What services do they really kind of provide to a patient, either in the inpatient setting or in the outpatient setting? The first one, and these are just from my observations over the years, number one being Assess and listen. Yeah, I think there's kind of that stigma that, the great therapists and the great psychiatrists, psychologists, all they do is talk. They're just talking and talking and talking and talking. That, in my experience, that has not been the case. The best therapists that I have ever seen work, they will spend twice as much time listening as they do talking. They listen, they observe, they assess. They're in the moment. They want to hear as much from their patients as they possibly can. They're great listeners, they're great observers, and they really know how to assess their patients. It's a big part of providing great therapy. They understand the critical nature of past events. Um, every person has a past. Every person has a history, and for better or for worse, our histories, our pasts, can affect us in the present day. They understand the influence of family, for better or for worse. And again, with the patients who I've worked with over the years, family is either a major benefit and resource for our patients, or on the flip side, family has been a major source of negativity or conflict, or even abuse in their life. But they understand the influence of family. They help alleviate bias and reducing stigma. Um, again, the great therapists, they really know how to let patients know that therapy is okay. Therapy is needed. This is not abnormal. This is not weird. Um, Therapy is healthcare, and healthcare is therapy, and there's nothing weird or strange about what they're doing. They help with the diagnosing of mental health conditions. They also teach how to cope and grieve. Um, I've had a couple friends over the past 4 to 5 years who have lost children, tragically. And two of my friends who I knew from high school, they've had to go through that process of losing a child. And both of them have told me that if not for the game-changing, wonderful therapist that they had, they're not quite sure what would have happened to them. They learned how to those therapists taught them how to cope, how to grieve, how to process, and needless to say, those therapists made a major impact in the lives of my friends. They help guide patients through many crisis type situations. They're very good on providing referrals and also providing support systems. One thing I will always mention, a term I use a lot in these presentations, I refer to them as commonalities. What are the commonalities? What do certain things have in common? Um, Almost all of the patients who I have seen over the last 20 years who have had amazing, wonderful, great recovery stories, one of the great commonalities I've seen in them, they have great support systems. It could be an Alcoholics Anonymous support system. It could be, a true support person within that group. And again, there are so many great support systems out there. And obviously, therapists, they are very beneficial in helping link up patients with great support systems. So those are just some of the things that a great therapist can do. What professional roles can provide therapy? And these are just a few of them. A psychiatrist, obviously, a licensed clinical social worker, a licensed mental health counselor, a licensed marriage and family therapist. Those are all the acronyms next to those titles. A doctor of philosophy, a PsyD, a licensed professional counselor, a registered nurse. I put registered nurse on here for a reason. It's so important to know that things change. That's one thing I always tell nursing students: always plan on a very large part of your job changing every 4 to 5 to 6 months. Things always change in the healthcare profession based upon research and evidence-based practice and data, all of the above. One of the things I am seeing throughout the country, not only in mental health facilities, but also in acute care settings as well, you are seeing more and more nurses providing therapy sessions, counseling sessions, and group therapy sessions. You're seeing that happening more and more. I know sometimes not every, just again, based on some observations I've seen, Some facilities and some hospitals throughout the country have been somewhat resistant to that new change. But again, just one thing I'm seeing happening more and more throughout the country. All these therapy roles must have a state licensure for the state that the therapy is being provided in. Um, again, being a therapist and providing counsel and therapy to people, we got to make sure those people know what they're doing. We got to make sure those people know their stuff. We got to make sure those people have the proper education, and not only the proper education, but also having their certification, having a true licensure. Um, these are potential life and death type situations, and we got to make sure we have the best and the brightest who are providing potential life-changing and life-saving therapy to people who are in extreme need. Quotes on the role of a therapist. Um, in doing some research for this presentation, I was able to find a lot of very unique kind of quotes about the role of a therapist and what a therapist does and the impact of a therapist. And you can feel free to read these quotes here on the slide here. I'll read just a couple here. A psychotherapist is someone who offers support, positive regard, compassion, guidance, a level of accountability, advocacy, and also a listening ear and sound clinical advice. Some of my favorite verbiage in this quote here is a level of accountability. Some of the best therapists I've ever seen, they hold their patients accountable. I've heard lots of patients say throughout the years that a big part of their recovery was they knew they were going to have to be accountable. It could be a weekly phone call or a weekly touch base session. Their therapist would have some accountability questions for them to answer. So that level of accountability can be a big part of a therapy process. And then the last one here. A psychotherapist is someone who helps people to remember that they are worthy. That's a big one. And I think that's so important because I've seen many patients over the past 20 years who have been through some of the most horrific things imaginable: abuse, neglect, sexual abuse, human trafficking, you name it, they've been through it. They've been through the worst of the worst of the worst. And they've gotten to a point in their own lives where they truly feel as if they're no longer worthy. They no longer matter. They no longer are significant. The great therapists, they're the ones who enforce into our patients, no, you are worthy. You are important. Your life 100% matters. The world will not be the same without you. You are a critical, very, very important person. Um, and and you deserve a wonderful future. And I've heard many therapists say, obviously your past and your history is important as it relates to helping you now, but don't let what has happened to you in your history define what happens to you in your future. So again, helping our patients remember that they're worthy is a huge part of what a great therapist does. The role of a life coach. I've heard many patients say before that their therapist was in many ways like a life coach. They were a mentor, they were a life coach, they were someone who could just provide really good common sense type instruction when 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 it was desperately needed. So again, a therapist can be a great life coach and be a great mentor as well, so to speak. Again, going back to my term on commonalities, the commonalities of the great therapists. What makes them great? Pick your profession, pick your job title throughout the world. There's a reason why some people are really, really good at what they do, and there's a reason why some people are on the opposite end. Just in my observations and just based upon the feedback I I have seen patients give their therapists over the years, this is what I've seen. A great therapist does not play the role of a friend. Um, they're there for support. They're there to help provide guidance and direction, but they're not a quote unquote friend. A great therapist does not tell you only what you want to hear. And this is sometimes the hard part. A therapist, sometimes the reason why they're good and therapeutic, they have to tell people the truth. They have to help people understand certain things. And sometimes that might not always be what people want to hear. A great therapist will take the time to know you as a person. One of my favorite therapists, one thing she would do in the first two sessions of her therapy practice with her new folks, those first two sessions were all biographical. She wanted to really spend some time to really get to know who that person was, their likes, their dislikes, their interests. Just again, we want to know you. We want to know you as a person, obviously with professional boundaries. But as one therapist say, you know, a therapist, it's almost like doing a head to toe assessment as a nurse. As a nurse, it's hard for us to provide care and treatment if we don't have a proper assessment. It's the same thing with a therapist. They need to know who this person is. A great therapist cares about the effects, but wants to know and also identify the cause. We'll talk more about this later, but again, for every effect, there is a cause. What are the root sources? What are the causes of your anxiety or depression or self-harm thoughts or trauma or PTSD or suicidal thoughts? What's the cause? What's the trigger? What's the root source of why you're experiencing these complications? A great therapist will challenge you. They're going to push you. I'm a former athlete. I played football and wrestled for many years. And the great coaches I ever had, the reason why they were great, they would challenge you. They would push you. They would make you better than you can make yourself. Again, I think the great therapists, again, they have a way of making their patients better than they can make themselves. A great therapist knows how to inspire and motivate. They know how to use their words. They know how to push the right buttons and pull the right strings to truly inspire and motivate their patients. A great therapist can sometimes be the least obvious person in your life or on your treatment team. Again, we want our therapy practitioners to be providing therapy, but sometimes, again, in my 20 years, I've heard patients say, boy, the best piece of advice I ever got in my treatment was from the unlicensed patient care tech, or it was from the I heard an EVS person say something, or I heard a dietitian say something, or I heard a patient's visitor say something that really was influential or very, very impactful. Again, those things can happen. And one of my favorites here, keeping it simple. Therapy could sometimes be very complicated. It could be very philosophical and really wrap a lot of things together. In my observations, the great therapists, they know how to make the difficult simple. They know how to teach. They know how to educate, and they know how to make therapy processes as simple as they can for the person to be able to follow along. The many stigmas of therapy and the damage it causes. It's impossible to talk about a mental health topic without bringing up stigma. I think we've come a very, very long way over the last just the last 4 to 5 years in changing stigma on mental health and mental health practices, but we still have a long way to go. All of the things, all of the statements and the bullet points you see here on this slide, these are all things I have heard. These are all statements that I have heard just in the past year, since last summer. And some of these statements have been made by just John Q citizens. Some of these statements I've seen in media or in social media. I have actually heard healthcare professionals throughout the country make some of these statements. So again, we've come a long way with changing stigma. We still have a long way to go. So again, some stigmas with therapy. Therapy is for the weak, people who just aren't very strong, people who are just deficient. Therapy is for people who cannot handle adversity. Well, they can't handle life, they can't handle challenges, so they just seek out therapy all the time. Therapy is not a real form of healthcare treatment. I've heard that one recently. Therapy is now being overdone in our culture. I Just watched something recently, just a few weeks ago, where there were some talking heads saying that our country and our society is over there. We've gone overboard with therapy. If you are receiving therapy, you might be weird. You're strange. You're different. You're unusual. If you are receiving therapy, you might be dangerous. I've heard that one just recently. And again, I mentioned earlier in the presentation, almost all the patients who I used to work with, they had massive concerns about people in their personal and professional lives finding out that they were seeking out therapy or in a therapy process. These are some of the reasons why. Men should never seek out therapy. I heard this one just recently, and that's tragic because just as an example, I've been able to present. It's called QPR. I say it's Question, Persuade, Refer. It's the suicide prevention course that we offer through the KU Health System. I've had the chance to deliver that suicide prevention presentation at 3 different construction company conferences over the past couple of years. And all of these construction workers, what they'll tell me is that they know they need help, they know they need therapy, but they're frightened to do it. They're scared to do it because if they seek out therapy, they'll be viewed again as weak, as deficient, as not being strong, all the above, and it's causing major problems. How media displays the role of therapy. I think we have lots of movies and television shows and TV series and so forth. I think the good news is we're seeing some changes with how media is showing and really illustrating what therapy is compared to what it was 15, 20, 25 years ago. But there's still some stigma in how media shows the role of therapy. Understand the reality of therapy dynamics. So I think it's so important for people to really understand the truth of therapy, the reality of therapy. The more people understand the truth and the reality of therapy, I think the more people are more inclined to want to seek it out. One of my favorite psychiatrists, the one thing he will always do before he begins his practice with a new patient, he will always make sure that his incoming patients know this following information. I think it's just something that all people should know about what therapy really is. Right out of the gates, therapy can be excruciating and difficult. It can be. It doesn't always have to be that way, but there are times and parts of the therapy process that can be very difficult and very stressful and also excruciating. Sometimes it can be difficult. Therapy can be a lifelong process for many people. Some of my favorite recovery speakers I've known for many years. I know one recovery speaker. She used to have a really, really horrific bad eating disorder about 30, 35 years ago. And she said on her best day, this is what she'll always tell the patients in her recovery sessions and her recovery speeches. She'll always say on her best day, she is 99.9% recovered. And that she still, 30, 35 years later, is seeing her therapist almost on a weekly basis. It's a lifelong process for many people to make sure that they maintain where they're at. Therapy is the only intervention for some mental health diagnoses. I give the example of a borderline personality disorder. There is no medication for a borderline personality disorder. It's about therapy. And we actually have a whole other presentation on understanding borderline personality disorders. Therapy is the intervention. It's what is needed for people to help them work with and understand and deal with their borderline personality disorder. So again, therapy, it is the intervention. Therapy is about identifying causative factors. That's a big part of what therapy is. It's about really understanding, again, this is what makes therapy hard. It's about understanding your past, your history. What are the causative factors? It just, for every effect, there's a cause. What are some of the past historical factors that may be contributing to your current symptoms? Therapy is most successful with continuity. Like with anything in life, continuity makes things a little bit easier. Again, the commonalities of patients who have had great success stories and recoveries, they will say once they found the right therapist or the right psychiatrist, they stuck with that person for years. And they found it was the right fit, it was the right connection, and that continuity was a major, major part of their overall success. Therapy results do not happen overnight. And I know in our new culture, we want those immediate, instantaneous, desired effects from certain things. That does not always happen in therapy. Sometimes I heard one therapist say she gave the analogy where you have to spend a lot of time and effort building the factory before you get your first can of peas, so to speak. So sometimes you got to do a lot of work before you start to see some of those therapeutic results. Why truth is the ultimate ingredient in successful therapy. I've seen therapists and psychiatrists fire patients before because they weren't being truthful. They weren't being honest. They weren't being, you know, true to their information. And they would say, listen, let me know when you're ready. Let me know when you're ready to be truthful and honest and direct. I'm ready to work with you. But until then, we're wasting each other's time. Truth, again, it's hard to find great therapy results when truth is lacking. Therapy is a marathon. It's not a sprint. Understanding that therapy can be for everyone. If I could wave my magic wand and make one thing happen, I wish every single person in the world could have at least one monthly therapy session. It could be beneficial for all of us to be able to sit down with a mental health professional and have a true counseling or therapy session. It would benefit everybody. And then the big one, the critical component of the therapist-patient dynamic. We'll talk more about this a little bit later on in a case study. There's a lot of trial and error with this. Again, mental health is subjective. Mental health is difficult. Mental health is challenging. Sometimes you have to go through a trial and error where, again, one of my favorite patients, she said she went through, over the course of a couple of years, she went through 6, 7, 8 different therapists before she finally found the right one that was the right fit for her. Not because that person was easier or more convenient, but because that person had that connection with her. And for her, that connection was the first step in her recovery process. Why therapy is needed now more than ever before in 2024. Guys, right now our climate in 2024, mental health, there's a spotlight on it right now. Depression, anxiety, stress right now for people in 2024, just for the John Q. Citizen, has never been higher. We're knowing now more than ever before on the epidemic of trauma and PTSD in our society. Again, stress, anxiety, it's affecting our society now more than ever before. How social media is affecting our mental health. And we have a whole other presentation on how social media affects your mental health. One thing I'll mention in this presentation, I just read this just a couple of days ago. There have been more people who have gotten off of Facebook and social media who've actually disabled their accounts. More people have done that in the last 6 months than the previous 5 years combined. That's amazing. You're just seeing now more than ever before, people are getting rid of social media. They understand that it does not help them. If anything, it's a negative in their life. I spoke with a nurse just a couple months ago who disabled their Facebook account, and she said she could see therapeutic results or changes in her life just a few days later. She's like, wow, I feel less anxious. I feel less nervous. I feel as if I have more time on my hands. And she said, boy, I wish I would have done this 6 months ago. So again, just we're learning more and more about how this is affecting our mental health, and sometimes in a very negative way. Physical therapy equals mental health therapy. Dare I say, if there is just maybe one takeaway from today's presentation, let it be this. for people who have a hard time understanding mental health and mental health treatments and mental health diagnoses and medications and therapy models, the more that we can relate mental health to acute care and physical health, the more people understand, or the better people will understand mental health. And I heard recently, I had a conversation with somebody, and someone said, boy, I found out that there was a nurse, I think it was like a mental health nurse who was seeing a therapist. And this guy said, boy, that's weird. If you're a mental health nurse, why would you see a therapist? You're a mental health professional. You should be you should be, you should be the one who knows the most about the stuff. Why are you seeking out help? And I said, okay, well, we're all Chiefs fans here. You know that Patrick Mahomes sees a physical therapist every single day? Patrick Mahomes is one of the most gifted athletes in the world. So why is he seeing a physical therapist every single day? And when I use that analogy, the guy smiled, and he kind of understood. Okay, that that makes a certain level of sense there. So again, the more that we can relate mental health to physical health, the best. Therapy is not just for when life is bad or when we're having challenges or difficulties or adversities. Sometimes the best therapy moments are when things are going well in our lives. It's just not for the troughs in our life. Why healthcare providers need the most therapy of anyone? Again, I think we've all had our moments throughout the COVID pandemic. We all know what we went through. Just as one example, we all know what we went through throughout the COVID pandemic, and the rates of healthcare professionals and nurses who have been diagnosed with PTSD and secondary PTSD, they're through the roof right now. So again, I'm so happy to see the KU health system and many other hospitals and health systems who are now providing more therapy support for healthcare staff. The many types of therapy, and you can spend a whole other presentation reviewing all the different therapy models. There's two I want to mention here in this presentation. The first one being is cognitive behavioral therapy, otherwise known as CBT. Basically, in short, it's about turning negative beliefs into positive beliefs and truths. I've seen many people, in my life, in my professional, personal life, who have really struggled with severe depression and just severe levels of self-hatred and self-loathing and so forth. And they said that cognitive behavioral therapy was a game changer for them in their therapy process. Then we also have dialectical behavioral therapy, otherwise known as DBT. That's more about processing stress, management of emotions, and also improving the relationships in someone's life. I've known people throughout my life who have really struggled with anger. They've struggled with emotional impulses and anger control, and they've said that dialectical behavioral therapy was a huge part, was a major game changer in making some successful life changes and adaptations. The role of family therapy and why it is critical. I know two people who are family therapists, and they've been family therapists now for many years, and they've never been busier. And you have families from across the societal spectrum who are seeking out family therapy. It could be, again, pick your demographic, your educational level, your financial status. More and more families are reaching out for therapy to try to get things corrected within their family structure. So we're seeing more and more and more of that happening as well. Wanted to review a quick case study here. I am a huge movie fan. I love and adore movies. One of my all-time favorite movies is Good Will Hunting, for a variety of different reasons. I love the movie. It's a great movie. Won a couple of Oscars. I think Robin Williams gives probably one of the best performances of his career in the movie. This movie, I think, it's just real. It's raw. It's authentic. It really shows, in my mind, the reality of therapy, how it's conducted and how it starts, and the roller coasters, the kind of the overall roller coaster that can happen between a patient and also a therapist. The peaks and the troughs and the valleys and all the things that can happen, the good moments, the bad moments, the hard moments, the easy moments, the fun moments. You see all of this in this movie. The character of Will Hunting, who's played by Matt Damon, I think he's in his early to mid 20s in the movie. He has a very severe past that's filled with abuse and neglect. Um, he went through some horrific moments of abuse and neglect throughout the foster care system. His character lived in Boston. So a big part of his life, of his history, was filled with abuse and neglect, and had some horrific occurrences in the foster care system in that city. His life as an adult. Again, in the movie, he's like in his early to mid 20s. He's a construction worker. He kind of does odd jobs. He's on parole. He also works as a janitor. He also just so happens he works as a janitor at the Massachusetts Institute of Technology, one of the top math and technology schools in the world. And with that job, you get to find out pretty quickly that he has some amazing talents. He's a gifted. He never even graduated from high school. He has very little education, but he can solve on the chalkboard at the MIT campus. He's the one who was solving all the math problems. Solving math problems only a few people in the world could do. He's just a genius, like an Albert Einstein type genius. So that's kind of who he is, and again, all of his amazing talents. Um, Finally, in the movie, they find out who he is, and that he's solving all these problems. And the main MIT director, he obviously wants Will to be the next Einstein. He wants him to be the next genius that solves all of the world's mathematical problems. But first, he wants to make sure that he has some sort of foundation in his life. So he seeks out one of his good friends from college. His name is Sean, and Sean is played by Robin Williams. Um, Sean is a fascinating character who also has his own past history with abuse and neglect and trauma. He's a Vietnam vet. He used to counsel veterans, and his wife also died of cancer in the movie. So he certainly has his own past traumas and complications and things of that nature. Um, the one thing that I really took away from the movie Good Will Hunting, and if you see the movie or if you've seen the movie, in kind of reflecting on it, for me at least, it's about finding the right fit. There's a scene, it's kind of a comedic scene earlier in the movie where the MIT director has Will meeting with all these different therapists and all these different counselors, and none of them are the right fit. They're just not. They're just, I mean, again, Will's character just has nothing in common with these people. There's no connection, and nothing could possibly happen well with these therapists. And then finally, Will is introduced to Sean. And right out of the gates, it gets pretty hostile, where Matt Damon, the Will character, actually makes fun of Sean's wife, who had just died from cancer. There's a major moment of conflict and confrontation. And of course, the MIT director just thinks, well, okay, if you never want to see him again, that's perfectly fine. But Robin Williams' character Sean says, no, I want to see him bright and early tomorrow. And that's where they have, it's one of the more famous movie scenes ever, where Sean and Will are at a park, and they're sitting on a park bench overviewing a lake. And Sean's character kind of gives them this amazing monologue about experiences and understanding what people have gone through. It's just an amazing monologue. And but then they have their, throughout the rest of the movie, they have their therapy sessions, and you see some major changes and advancements in Will's character. And I think one of the really cool things about this movie is that Sean, he's concerned with Will. He wants what's best for Will. The MIT director, he just wants Will to be the next Einstein and solve math problems for the rest of his life. Sean is only concerned about Will. Sean wants what's best for Will and what's best for his life. That's Sean's chief number one concern. And Sean, again, as I said earlier about, what are the commonalities of the great therapists? He pushes Will. He challenges Will. He tells Will some things he doesn't want to hear. He gives advice, he gives mentorship, and he asks some very, very tough questions, and he really challenges Will to kind of to get outside of his box, so to speak. And there's also a scene at the very end of the movie that's very emotional, where they have a true embrace, where they both kind of relate to each other, their connection on past abuse and neglect. They have an amazing kind of embrace, and it's a very, very emotional scene. But again, I think it's a great case study on the role of therapy. It's a very obviously it's a Hollywood depiction of it, but there's a lot of realness with it. I think again, one of my main themes from the movie is why the messenger can be as important as the actual message. Again, it's the person, it's the connection, it's the one-on-one, and sometimes that can be the biggest influence for patient recovery. Wanted to wrap up here with a story of hope. One of my main goals for 2024 is to start to share more stories of hope and start to share more of our great mental health success stories. I think sometimes we only tend to hear about the sad stories, but I think for every sad story, there are at least 5 or 6 great stories that we never hear about. And this story took place back in 2005. I was only 23 years old, had only been working as a grad nurse for about a year. And one thing I always tell nursing students is there are some patient care encounters that you just never forget. They are permanently ingrained into your mind. You don't forget them. They're with you for the rest of your life. They're that impactful. They're that memorable. And on my unit, most of our patients there were probably in their early to mid 20s, teenage years. We had some patients who were in their 40s, their 50s, or their 60s, but that was pretty rare. We had one patient who was on our unit who was 95 years old. Our medical director was very cautious about having them come to our unit, but she was an amazing woman. Again, she was 95 years old, a very specialized type situation. And basically, her words to us were that she had been suffering from a horrible, terrible eating disorder for pretty much her entire life. And she said, before I pass away someday, I want to have victory over this eating disorder. I want to recover from this eating disorder. I want to be able to say I did this before I pass away someday. She was on our unit for close to 3 months. And she was the most amazing person, and she was really all in on her therapy, her counseling, and she had a great recovery story. She worked so hard, and she gave all of her effort and all of her emotion to the experience, and she was one of our great patient care success stories. And I remember on her discharge day, it was her last day with us, and she was being discharged, and her great great grandson was taking her home, and she was on cloud nine. I remember being in the room with her along with her psychiatrist, and she was on cloud nine. She was just filled with life and joy and success and happiness, and what I remember the most was she kept on thanking her psychiatrist and also her therapist. She said, "Boy, this therapy, it changed my life. It was the first time I have ever received therapy, and it was a game changer for me." And she kept on thanking all of us for treating her like a person and not like a number. She probably said that at least 10 different times. She said, "Thank you so much for treating me like a person and not like a number." Again, she said that over and over and over again. Um, and she said, obviously, this individual therapy and this counseling, it was truly individualized for me. So thank you for treating me like a person and not like a number. And then she said this, and there was one thing she had on her, and we never asked about it. She had an ace bandage that was wrapped around her forearm throughout the entire hospital stay. We kind of got used to it. We never asked about it. It was just kind of there. And then she said, I know what it feels like to be treated like a number. And she unwrapped her ace bandage. It was like out of a movie. It was so dramatic. And she opened up her arm, and there was a barcode tattoo on her forearm. And she proceeded to tell us the story on how she survived the Holocaust and how she survived Auschwitz and how she was able to come to America and live her life. And it was the most incredible, most unbelievable story I've ever heard. It was just remarkable. And she said that, you know, it was, she told us the whole story, and she said that was maybe only the third or fourth time in her entire life where she shared her story with somebody else. And it was just a remarkable moment. It was a remarkable story. Um, and we got letters from her over the next few years, and just her telling us how great she was doing, how therapy changed her life, and how therapy was the game changer for her. So that story will always kind of stand out to me about how therapy can be for everyone. Therapy can help people in the darkest moments of their lives, and again, just how special therapists can be and how they can be the true game changers in people's lives. A lot of information here. Um, Again, this is kind of a tip of the iceberg type presentation, and I hope this was somewhat informative as it relates to, again, the critical role of therapy and what therapists do and how impactful therapy can be. Does anybody have any questions, comments, or thoughts, or anything else they would like to add before we sign off here? Any questions or final thoughts before we wrap up? If you guys have not already done so, make sure you click on the chat conversation icon box here and type in your full name and your email address. That way we can get you on the roster for CEUs. I appreciate your guys' time. Um, again, going forward, you have my email address, so feel free to reach out to me if you have any other questions or thoughts or comments. And I appreciate you guys being a part of this presentation today. Thank you, guys. Have a wonderful day.